Hi, I'm Jeff Blumberg and I'm the Chief Operating Officer at MGE. So what is the job description for a treatment coordinator? In an earlier tip, which you can find right here, I got into the idea of an overview of the position and how to determine whether or not you actually need one. In this tip and in next week's tip, I'm going to be breaking this position down a little bit more in depth so you can get an idea of exactly what it is they do on a day-to-day basis, as well as what the overall objective of the position is. So I want to start with just, we're going to use as an example a different type of business for a minute. If you had a business, let's say you were selling furniture or you made furniture. Well, someone would have to sell that furniture, all right? You'd make the furniture, someone has to sell that furniture. You might have you might have a team of salespeople, you might have one salesperson, you might have a team with a person in charge of the whole sales force. All right, but what would be their primary job? Their job would be to get people to get the furniture that they, are looking for, right? And they would be responsible for the overall income of the business. The sales force, pretty accepted basic concept. Well, in essence, that is what a treatment coordinator does in a dental office. They are the head of, or they might be the only part of, your sales force. And I alluded to this in my last video, but I'm going to just again kind of make it a little bit more solid here. The whole subject of sales in healthcare in general has a bit of, Dr. Wintereg wrote an article, sales isn't a four-letter word. Yeah, which it isn't because it's five-letter, whatever. Anyway, so the whole subject of sales with relation to healthcare gets a real bad rap. No doctor wants to even conceive of that they have to sell. But I want to point something funny out to you for a minute. If you go to the store, let's say it's a department store, a clothing store, whatever, you meet with a salesperson. Their job is to get you to purchase the clothes that you're looking at. Now, here would be my question for you. If you're looking at a pair of shoes, do you need those shoes? I mean, maybe you do. Maybe you have no shoes. Unless you came in barefoot, right? Maybe you need them for a special event. For the most part, if you walked out without buying those shoes, you would be absolutely fine. Nothing would change in your life. You don't need them, you want them. When it comes to dental treatment, unless we're talking about veneers, right, something cosmetic that a person doesn't really need, it's needed to restore function, health, or aesthetic, especially function and health. The person needs 3 root canals and 4 crowns. They need that. They don't need the shoes, but they need that. But here's what's funny. Have you ever talked to a patient and you said, hey, you need XYZ treatment? They said, oh, yeah, doctor, I really love to get it, but I'm buying this new 85-inch TV. And you wonder, well, is there something wrong with this patient? No, there's nothing wrong with this patient. They just don't understand the importance of what it is that you're trying to explain to them. One of my coworkers mentioned if you go to your medical doctor and they say you need this antibiotic, you don't go, oh yeah, I'm going to go on a cruise. No, you get the antibiotic. You might say, oh, well, it's covered by insurance or whatever, but the whole point is, you need it. Well, in dentistry, patients need this treatment, yet you have some walk out not getting it or trying to do the cheapest version or something of this nature. So healthcare, unfortunately, specifically dental care, has to be sold. And I already went over in that last video, how we define sales. It's not about lying or high pressure, whatever. It's about good communication and getting people to understand. So it requires someone sitting in front of somebody else and explaining exactly what's going on, to a patient so that they actually fully understand the importance of what it is that you are explaining. It has to be sold. It's funny that you have to sell people things they actually need, and then other things that they just want, you don't have to sell. It's a funny state of affairs, but it is what it is. All right? So essentially, the treatment coordinator is responsible for selling and ensuring that patients get the treatment that they need. And truthfully, the treatment coordinator position, if you want to look at their overall responsibility, they're responsible. I mean, of course, you as the doctor are overall responsible, but they're responsible for the whole patient base to ensure that patients are getting the treatment they need, whether they're a new patient or a patient of record. When we pick up with the next tip, we're going to get more into the doctor-treatment coordinator relationship as well as the doctor-treatment coordinator pass. In the meantime, if you want to know more about MGE, check us out online at mgeonline.com. You can call us at 800-640-1140. And if you'd like to see more tips like this, definitely click the subscribe button and the alert button so you're notified when they come out. I'll see you back at the next tip.